I'm Byron Day. We are taking you live now to Montgomery for a hastily called news conference by the governor of Alabama.
As I've already said publicly, I'm grateful that the Alabama legislature was able to finish its business on Monday, adopt and approve both budgets, and agree on a pathway forward to make certain that the Federal CARES Act monies will get to the people of Alabama who have been economically impacted and hurt by this disease, and obviously those are the folks that need and deserve help. In the next week, my administration will be announcing some different ways that members of the legislature as well as the people of Alabama can have direct impact into some of the different options that might be available. Today, however, is the next step in what has seemed like a long and difficult process of reopening our economy, while at the same time remaining true to the belief, the fact that, y'all, this is a serious, deadly disease. As Dr. Harris said yesterday, our numbers are not as good as we would hope. And in some cities and counties, Montgomery being one of them, there's some very legitimate concerns with a large number of people being hospitalized, filling our ICU beds. And this is not only a cause for concern, but it's something we're certainly going to keep a strong eye on in the following days and weeks. Now, in all fairness, all of the patients in ICU are not COVID-19. So if you've had a stroke or a heart attack or been hurt in a car wreck, certainly you need to be in an ICU bed. Regretfully, many of our nursing homes are still a hotbed of activity for COVID-19. And that's why neither Dr. Harris nor I can, with a clear conscience, allow things to return to normal as it relates to reopening our nursing homes and hospitals to visitation beyond compassionate care situations. There's also more troubling news on the economic front. Tomorrow, Secretary of Labor Fitzgerald Washington will announce Alabama's unemployment rate for April. It seems like a lifetime ago when our unemployment rate was at an all-time record low of 2.7 here in the state. But when more than 500,000 people filed for unemployment during the past 2 months, and more than $1 billion has been paid out in unemployment compensation, folks, that's a lot of hurt and a lot of pain out there. On the positive side of things, we have some good news. This week, the state of Alabama, and in particular the Department of Public Health, inked a deal with two of the biggest technology names in the world, Apple and Google, to use their contact tracing app to track those who may have been exposed to COVID-19 using Bluetooth signals. Alabama, North Carolina, North Dakota, and South Carolina are the three first states in the United States that have joined some 22 countries around the globe to join hands with these two global giants in hopes of helping our people learn how to, when and where they may have gotten contacted or exposed to this virus. And hopefully this will become an important tool in the toolkit to slow the spread of coronavirus by using what almost every Alabamian has in their pocket, a cell phone. Entering the stay-at-home order in April and the current safer-at-home order, which we are now in, has always been an attempt to slow down the spread. We knew we would never be able to eliminate it, but we wanted to slow it down. The drastic measures of the last 2.5 months have been out of a need to slow the spread and help prevent a surge of our hospital ICU beds. Obviously, in the state, some are experiencing higher rates than others, but however, statewide, we have not exceeded capacity, and everyone who needed a ventilator has been able to receive one. Currently, there are medical experts all over the world working on finding a vaccine. And for the record, I want to let you know I will not be at all surprised if a vaccine was created right here in Sweet Home, Alabama. However, we cannot sustain a delayed way of life as we search for a vaccine. There are many viruses that we live with and have worked necessary precautions into our daily lives. And similarly, it's now time that we move forward and further open our state and live with a new normal of incorporating COVID-19 precautions into our routine. Now, as it relates to the changes in the current order, let me get right to the point. Just as we've had to learn to live with the flu and other viruses for which there is no known cure, it's not realistic to think we're going to be able to keep everyone totally isolated from each other forever. To that end, effective Friday, May 22nd at 5 p.m., and running through July 3, we're going to expand the number of businesses that will be allowed to reopen while maintaining a 6-foot distance, and by adding an extra layer or two of prevention and precaution on those who own these businesses as well as those who frequent these businesses. This will have the net effect of expanding our recent Safer at Home order with 3 caveats. The first is, if things don't get worse, and I certainly hope and pray they don't, then we're going to continue putting personal responsibility on each and every individual citizen. Personal responsibility also extends to the store owner, the summer camp operator, the hairstylist, the youth sports coach, and pastors. It takes all of us, y'all, being vigilant and adhering to these social distancing guidelines in order to stop the spread of this disease. And I'll just tell you, I sure miss being with my friends, going to church and having breakfast at Dirk's. But I've learned how to hold Zoom meetings, speak virtually to a Rotary Club, and I'm going to do my first drive-by birthday party later this afternoon. We can all do our part. However, if we start going in the wrong direction, then we reserve the right to come back in and to begin to reverse course. Secondly, although we're expanding the list of places that can reopen, we're also adding important additional requirements on social distancing and sanitation that we all must adhere to. As Dr. Harris and I keep saying, this disease is deadly, and it is not something that we can take lightly. And finally, for those who just aren't comfortable going out to your favorite establishment and acting though everything is back to normal, we get that. Clearly we get that. And you're right. Things aren't back to normal. And in fact, we probably don't yet know when the new normal is going to look like. So let me invite Dr. Harris to come up and give his report, and then we'll be happy to take your questions.
Thank you, Gunn. Hey, good afternoon, everybody. Thank you very much. Thank you, Governor Ivey. Appreciate it very much, the chance to be here. As the Governor said, we certainly would like to see some improvement. We have about 13,000 confirmed cases so far as of today. Our recent numbers, daily numbers for the past several days are around 355, 366, 297, 342, 321. So we have a fairly level number of cases over that time, although a little higher than when we were here last. That said, our percent positive of cases, the percentage of cases that are positive when we test has declined for the past 3 weeks. I don't think that means that we're out of the woods by any means. I think that means we continue to have disease transmission here in our state, and there's a lot of care that we need to take and a lot of practices that we need to continue to work on and to emphasize with people. We certainly have hot spots in parts of our state. Right here in Montgomery is one for certain. We've certainly seen them in other parts as well. And I think what we anticipate going forward over the next few months is that we will have these rotating hot spots. We may have lower levels of transmission going on in different places, but we'll continue to see places where we get a surge from time to time, and that's similar to what we're experiencing right now. As of today, we have over 600 patients hospitalized around the state, but we're fortunate that ventilators are okay. Ventilator capacity is good, even here in Montgomery. As the governor mentioned, we have a shortage of ICU beds here, although statewide our capacity remains good. As we see, all 50 states now are moving towards at least some form of reopening. We want to make sure as we do that in Alabama that we continue to issue health orders that are responsible and that continue to keep people safe and continue to emphasize all the things that we need people to remember. This still is a safer at home order, and we want to emphasize that. We believe people are safer at home to the extent that's feasible. We believe people who have certain medical conditions or are medically fragile really are safer at home, and we want to encourage them to remember that in their behavior. So let me highlight for you what the changes are in the current order. We have more things that are opening, but we've issued more guidance on safety and more guidance on behavior and more guidance on the practices that we would like to see businesses and people to put into place. This health order will run through July 3rd, as the governor said. We will continue to have non-work gatherings ruled the same. That is, there's no number limit on non-work gatherings, but we would prohibit any type of gathering within 6 feet of people from different households. That certainly continues to allow things like churches to meet and many other type of social functions, but we want people who are not family members or not from the same household to continue to observe that 6-foot distance. Child care facilities have remained open, but we are not adding an additional number limit or maximum on those child care facilities, as we previously had required less than 12. There are, of course, DHR requirements about staffing ratios, which this doesn't affect, but child care facilities can continue to remain open without that limit, but we have added social distancing requirements for adults. That's certainly not always feasible for kids, of course. And some sanitation and hygiene requirements as well as face coverings for staff working in those facilities. We have addressed all the entertainment venues that were previously closed under the last couple of iterations of the order, things like performing art venues and museums, tourist attractions, and so on. We have specific guidance for a lot of those. We had received guidance from industry and also a great number of guidelines from CDC related to things like water parks, for example, bowling alleys and things like that we have made reference to in the health order. Those venues are going to be allowed to operate at 50% capacity, and we have, again, certain social distancing requirements, sanitation and hygiene rules, and the use of face coverings whenever that's appropriate. This health order will remove the closure of schools. Obviously, K through 12 schools is what Dr. Mackey and his team have been working so diligently on, and they continue to work on that plan and issue guidance to all the school boards around the state, who ultimately will make those decisions about when it is safe to reopen. Colleges and universities obviously are working on their own plans related to that. The main effect of the health order has to do with certain technical and specialty schools. We have a lot of schools like truck driving schools and aviation schools and culinary schools and so on that are training programs that are allowed to reopen subject to certain restrictions like I had mentioned before. Finally, youth sports and other athletic events are going to be allowed on a gradual basis, starting when this health order takes effect tomorrow evening. There will be practices, conditioning, drills, that sort of thing for youth sports, and then we will ask them not to engage in direct competition, which would draw crowds of people until after June the 14th. So effective June the 15th, that youth sports competition and other athletic competitions can resume at that time. And then finally, I'll say, like with previous health orders, these are statewide health orders, but we certainly recognize the ability of Jefferson County and Mobile County health officers to issue those orders that they see appropriate for those communities as well. So that's the highlights of those health orders, and I'll in a minute be glad to answer questions about that. I just want to say that reopening Alabama really only works if we all cooperate. We are moving to reopen these things, but it has to be done safely. This is still a safer at home order. We really need people when they're going out to businesses and going out in crowds to remember face coverings. I want to emphasize that. We really need people to avoid unnecessary trips. If they don't have to make them, please use your discretion and use your common sense. Please stay home if you're sick. All of these things we've been talking about for weeks and weeks now about hand washing and so on are so vitally important if we're going to make sure we're protecting the most vulnerable people we have. These are really simple changes in our behavior, but they save people's lives, and they're really important. And really, now more than ever, we need people to take social distancing seriously. When people were sheltered in place, honestly, social distancing wasn't quite as important. But as the economy reopens, it's even more important than ever. So we don't yet have a cure or a treatment for this disease, but the best thing that we have is for each of us to watch our own behavior and make sure we're protecting ourselves and others. So thank you very much.
Thank you so much, Dr. Harris.
Yes, ma'am.
Rashawn?
Governor, are you comfortable with the level of testing that the state is doing as things try to get back to normal?
Do what now?
Are you comfortable with the amount of testing that's being done here in the state?
I don't know that we can ever do too much testing, but we certainly increased the amount of testing, and I think somewhere I was told that the number of tests that come back positive has been on the decline, so that's a good sign.
Governor, you have said that you would make decisions based on data and not dates. Now, the daily data from ADPH says since the Safer at Home order, at times we have seen daily number of cases jumping by 100. How do you justify relaxing restrictions with the number of cases rising? Originally you put in place that shelter-in-place order, you said that's because we were jumping at 100 cases each day at times. So what's the justification here?
Well, standing by and letting our businesses collapse while we've got hundreds of thousands of folks that are hurting and suffering is not an option. And so we've got to keep our businesses open and keep our people working. The key to it is personal responsibility by the businesses of Alabama and by individuals. Everybody must be a part of personal responsibility. Having a life means having a livelihood too. You can't have a life without livelihood. So it's important for us to go back to work, to open up the economy, but also it means that we've all got to take personal responsibility.
So at this point you're looking at the economic data instead of the case data.
You've got to have a balance between looking after the people's health and also the economic health. There has to be a balance.
We have time for a few more questions.
I have a question for Dr. Harris regarding, we're heading into Memorial Day weekend. A lot of people are going to be either on the water. One of the things that I didn't see in here were pools. What is the guidance? What is the state recommending to private and public pools as well as travel on lakes heading into Memorial Day weekend?
Yeah, pools have been open since the last health order, in fact, and so we would just encourage people to remember all the other guidelines that we've brought up. Gatherings between people who aren't in the same household of any number are not permitted, and so pools have, in a sense, a capacity issue if you think of it in those terms. We didn't set a number, but obviously a pool is a defined size, and you can only put so many groups of people there.
You mentioned personal responsibility on a busy weekend. How important is that?
Yeah, personal responsibility is the heart of everything that we're trying to do. I don't think we sometimes make that point enough, but people can have this disease and spread it and not feel sick. And so the personal responsibility is to protect other people. It's not just that you yourself are worried about getting infected, but we need people to understand that they can put others at risk and not even realize it. So keeping distances, washing hands, sanitation, face coverings, all those things are the way that you take care of the people in your own family and in your own community.
Dr. Harris, are you comfortable with the level of monitoring if testing is still limited in the state and given that we have hotspots like Montgomery here?
Yeah, I think we always wish we could improve that. We have made a lot of improvement in testing. The goal that we have been striving for, based on White House guidance recently, is trying to test around 2% of the population per month. We're actually meeting that goal in all but about 10 or 12 counties in the state. We have been able to achieve those numbers, so we do feel better about that. Where we could certainly stand to improve is our ability to respond quickly when we have hotspots, when we have a sudden demand for a large number of tests. When that happens in a populated county with a lot of testing capacity already, we can handle that pretty well. When it happens in a county that has less resources, it's more difficult to do that. So we continue to look for ways to do that. We found a number of partners who are able to increase the capacity in their own labs that are doing testing in the private world. And overall, our testing numbers have gone up and up really almost every week since the beginning. But again, we do have those hot spots where we don't have as much as we would like.
All right, we've got time for a couple more questions. We'll go right to the chair.
Thank you. Governor Ivey, on the last day of the session, Senators Roger Smith and Bobby Singleton mentioned there's not a single member of the minority party sitting on the committee that will oversee the state stimulus funds when the spending exceeds $2.5 million. Senator Singleton would like you to issue an executive order adding a member of the minority party to that committee. Is that a possibility?
Well, the legislature's gone home. They signed and died, on Monday night. So you can't attach an executive order to something that's not before the legislature. Yes, sir.
Governor, on Tuesday, the CDC released guidelines for reopening schools where they recommended that the students stay in their same classroom, in their same desk the whole day, and not to share keyboards or art supplies or books or toys or any of the normal materials that students have at school, all which are community shared. Is there going to be money under the CARES Act for schools to button up their supplies so every child has all the materials they need when school starts?
In the CARES Act, the executive amendment that was passed does contain amount of money for schools. And Dr. Mackey's on top of the CDC guidelines, some of which he says are just impossible to accommodate, but he's working to make it as safe as we humanly can.
Dr. Harris. One final question.
Dr. Harris, Montgomery Mayor Stephen Reed said if you need an ICU bed in Montgomery, you're pretty much in trouble. He implied that the city was out of ICU beds. Do you agree with that?
Yeah, thank you. So I certainly am aware that they have many of their ICU beds already filled. The situation in Montgomery today, from my conversation with Dr. Williamson at the Hospital Association, is that the conventional ICU beds that they count as ICU beds are full. Although the hospitals do have other spaces that can be used for ICU beds that they wouldn't normally count as an ICU bed, and they do have some capacity available there. That said, I would say hospitals frequently, from time to time, have issues like this, and they generally do work those issues out between themselves. So, flu season, for example, can be a time when your hospital gets pretty full. Transfers to Birmingham from Montgomery are not very unusual. We certainly see those things happen a lot. For that matter, I don't know, but I suspect a lot of people in Montgomery hospitals are from other parts of the state as well. We certainly are a regional referral center here as well. So I absolutely agree with the mayor that they have reached capacity there, but I also believe they have the ability within their four walls to handle that and handle more if necessary.
All right, and that's all the time we have. If you have any follow-ups, you know where to get us, and the governor will close to help.
Thank y'all. Have a good weekend. Be safe.
All right, you've been listening to Governor Kay Ivey in a hastily called news conference, and a bit of a surprise. I think there were a lot of people that thought, because the number of new cases in the state of Alabama have jumped in recent days, that many thought that she might roll back the safer at home order that she put in place about 11 days ago. Instead, the governor apparently doubling down on the people of Alabama becoming even more personally responsibility for their own health. But toward that end, she has now amended her Safer at Home order to include changes which for things such as theaters, tourist attractions will now be reopened, but at 50% capacity. Other changes, schools will now be open, depending again on taking personal responsibility as far as safe distancing, for instance. So this new order goes into effect Friday at 5 o'clock. And I know that many schools are anxious to start band practice, cheerleading practice, football practice, preseason practice. So now they can start those programs, but they're going to have to observe social distancing, hygiene, and other things that go along with this Safer at Home order. The governor was asked, basically, that remember a few weeks ago, she said that I'm going to depend on data and not dates as far as when I believe that Alabama can move forward safely within the coronavirus pandemic. Today, she said that it's a matter of getting businesses back on track, that you can't have one without the other, that you've got to be able to have the health of business as well. You've got to have that balance between the health of people and the health of business, because she says the two go together. And right at the top of the news conference, she talked about the fact that unemployment has skyrocketed. 500,000 people are out of work at this time. $1 billion in benefits have been paid out. That's about the same amount that you would pay out in about the last 6 years, if I remember correctly. So just to kind of wrap things up, the governor has amended the Safer at Home order, expanding it now so that that will include different venues as far as entertainment venues. Now, she didn't say anything about nightclubs, but she did talk about theaters and things like that. But again, she's talking about opening those back up. Also, child care. They still will be open, and now they can expand a little bit more. But again, with the safe distancing recommendations that have been made. The other issue is she is still keeping visitors away from senior centers such as nursing homes and long-term care facilities. Those continue to be hotspots around the entire state. I believe I read this morning that 16% of all new cases in the state of Alabama are coming from nursing homes, either residents or workers. So what the state is continuing to try to do is to try and control that spread, so no visitors will still be allowed to enter any nursing home or long-term care facility. But other venues are now open. Camps, for instance, are now open. Water parks are now open. But again, they're going to be subject to social distancing, hygiene, and also she did reiterate that masking up has got to be something that Alabamians have to do. But again, as I mentioned just as we were wrapping this up, wrapping our news conference up, that apparently she appears to be doubling down, that the people of the state of Alabama will exhibit even more personal responsibility when it comes to social distancing, when it comes to personal hygiene, like washing your hands at least 20 seconds, and making sure that you're wearing a mask when you're outside. And she did also say that for people that are uncomfortable or that may have underlying health issues or that are sick, that the best thing for them to do is to be safer at home. In other words, just stay at home. Don't plan on going out. That's the bottom line, according to Governor Ivey. But again, she just said that it is time that we have to get, we're going to have to just work through this, as she said, as the state has worked through influenza, which there is no cure for that, and other diseases that they work within those parameters. Same thing with COVID-19. Life must go on, according to Governor Ivey, and that means helping Alabama open up, reopen, getting back to business, and getting about the business of life. I'm Byron Day. Of course, we're going to have more coming up on Fox 10 News at 4 and 5 regarding the governor's amended Safer at Home order that she just put into effect. It will start happening tomorrow at 5 o'clock. More on this story coming up on Fox 10 News at 4 and 5.
This has been a Fox 10 News coronavirus update. For the latest breaking news, stay with Fox 10 News on air, online, and on the Fox 10 News app. We now join our regularly